Hi everyone, and welcome to my final presentation of current topics in strength and conditioning. I chose the article titled Effects of a One-Year Randomized Controlled Trial of Resistance Training on Lower Limb Bone and Muscle Structure and Function in Older Men. And this is part of our weekly topic of resistance training in the elderly population. Specifically, this article is looking at the effects of resistance training on bone mineral density. So what we currently know about weight-bearing exercise and resistance training within the elderly population is that first and foremost, that weight-bearing exercise increases bone mineral density. It has a positive effect in a number of studies looking at both premenopausal and postmenopausal women, that weight-bearing exercise actually improves and increases BMD. And actually they found that not only does weight-bearing exercise increase BMD, but resistance training improves BMD to an even greater degree. And then even beyond that, progressive resistance training has the most favorable impact on bone mineral density in both premenopausal and postmenopausal women. So that's not just elderly women, but women in general. So women of all ages benefit from resistance training. We've also known that resistance training is significantly better at improving bone mineral density in women than just walking programs. And we haven't really done a lot of investigating into those differences with men, and so that's what the current study is going to look at. But in addition to what we currently know and what kind of sheds light onto what this study is investigating is also looking at strain magnitude and strain distribution. And in the introduction of this article, they talk about a number of animal studies that demonstrate that a high strain magnitude and strain distribution, or uneven or irregular strain distribution, has more favorable effects on bone mineral density than a lesser strain magnitude or consistent strain distribution. Now, those are all big words, but if we translate that to human subjects, specifically relevant for our study that we're about to talk about, that just means that exercise has the potential to create that strain magnitude that's great enough to cause increased bone mineral density. It's a large enough stimulus or intense enough of an activity to elicit that effect. And exercise is also uneven or unusual distributing of weight because it is weight bearing, and because of that it also has a similar effect on bone mineral density. So both of those factors affect humans in that way. So this particular study is really looking at these two research questions. First, what level of physical activity is sufficient to maintain bone mass in older men? And that's kind of what I was discussing on the previous slide about a strong enough stimulus to maintain or increase bone mineral density and bone mass, and that strain magnitude. So really, what level of physical activity will create that sufficient strain magnitude to maintain bone mass? And then secondly, is this level and mode of exercise different than what researchers have observed in women? So really, are there differences between men and women in regards to growing and maintaining bone mass as we get older? In terms of methodology, this study was conducted in Australia, and they recruited all of their 143 participants through the Australian voting registry. They sent letters over the listserv, and they eventually recruited 143 subjects for the study. Average age was 64 years old with a standard deviation of 6 years. So considered older adult men, but they certainly weren't very old. And then in terms of inclusion and exclusion criteria, because they were most concerned about bone mineral density, exclusion criteria included men who had who were taking medication that would potentially affect their bone mineral density and bone mass, if they had known disease related to their bone health, they were excluded from the study. If they were regular participators in resistance training, they were also excluded from the study. So they wanted untrained individuals in this particular study. And then a BMI over 30, you were excluded, as well as a number of other just health-related things. They wanted healthy, untrained subjects. So really the only inclusion criteria was that they could commit to the entirety of the study, that they were healthy enough to participate in regular exercise, and that they didn't participate in moderate intensity activity for 2 hours a week or more. So again, really just untrained but healthy older adult men. And once they got their participants, they split them into a resistance training group and an active control group. Now, the authors of the study actually noted that they didn't want just a plain control group, because they found that to be unethical to not at least inform the control group that exercise would greatly benefit their health. So instead of comparing resistance training to just no activity, they're comparing a walking group to resistance training group. So to flesh these out, the resistance training group participated in 3 one-hour exercise sessions every single week, and the study lasted 12 months, so it was quite the commitment. And these men actually progressively moved through their resistance program, and these were guided through some exercise physiologists, some professionals, and they followed the American College of Sports Medicine guidelines for resistance training in the elderly population. And eventually, by the end of the 12 months, they were doing working sets of 8 reps to their 8 repetitions. So it was pretty intense resistance training. And then in the active control group, they basically had the control group attend a seminar in which they were advised about the benefits of walking and stretching regularly. And then they were told or informed that walking regularly, specifically 3 times a week for 30 minutes, would be beneficial for their health, and that's what their assignment was for a part of the study. They were instructed to do no additional exercise, and they just had regular check-ins when they came in to be measured and to get data collected to make sure that they were adhering to their walking program, which was supposed to be not incredibly intense, but really just to be an active control group for comparison. All right, so this particular study collected a lot of data, and they did it at 3 separate points in the study. So they did it at baseline. They collected data after 6 months of resistance training or the unsupervised walking program, and then they also collected data at the end of the study at 12 months. So first and foremost, they did bone mineral density tests at the hip, the lumbar spine, and a total body measurement as well, and they used a DEXA machine to do that. So they did those three separate scans at each 3 of those points in time. They also collected dietary and caloric consumption data, and they didn't have the subjects regularly track their food, but at the 3 separate measurement times, they had the participants collect or write down a food diary for 3 days of the week, and they actually planned it so it would be 2 weekdays and 1 weekend day, to kind of account for any variability that may occur when someone goes from working to not working on the weekends and vice versa. So They collected dietary information. In addition, they did hip abductor and leg press strength at a 3 repetition max, and that was to measure strength over time. They wanted to assess overall fitness or aerobic fitness using a 6-minute walk test. So basically they just had 2 markers on the floor, and they were instructed for 6 minutes to walk back and forth on these markers, and the distance they could cover within that 6 minutes was measured and recorded, and that was an assessment of their personal fitness. And then finally, at each of the 3 measurement points, the participants filled out what's called an IPAC. It's really just a standardized physical activity questionnaire that categorizes them into low, moderate, or high physical activity levels. And that was one of the ways that they could ensure that the active control group was truly staying in the low to moderate physical activity level, and they weren't deviating from what the researchers had advised them at the beginning. All right, so getting into the results section, and I think you guys may find this pretty interesting. I definitely did. So this is a snapshot of bone mineral density changes for both groups across the course of the study, from baseline to 6 months to 12 months. Now you guys can see that there are asterisks near some of the numbers, and that signifies that those were particularly significant or statistically significant in this case. And so there was a significant increase in total hip and trochanter bone mineral density at 12 months in both groups, but not the whole body or the spine. And actually the researchers weren't very surprised by these results, just because the resistance training group in particular, they chose exercises that would be particularly weight bearing or heavy on the hips. They wanted to see bone mineral changes in that particular region. So in the resistance training group, they weren't surprised to see that, but the active control group, that was a little unexpected. There were no significant differences between the resistance training group and the active control group in the post-test bone mineral density. So both started out statistically the same. Both groups were very, very comparable. But following the 12 months of a progressive resistance training program, there was no difference between the walking group and the resistance training group in bone mineral density improvement, which was definitely not what I was expecting to find in this study. As we continue to look through our results section, these are the other measures that the researchers were looking at, including strength, overall fitness, and then body composition as measured by the DEXA. And there were actually significant effects on muscle strength and overall fitness for both of the groups. So the resistance training group saw increases, statistically significant increases in their leg press strength, their hip abduction strength, as well as their 6-minute walk test. And so did the active control group at the end of the 12 months. But the big kind of takeaway from this screenshot is that there were statistically significant differences in the amount of improvement between the resistance training group and the active control group in strength, overall fitness, fat mass, and lean mass at post-test measures, aka the 12-month period. So really what the takeaway is that the resistance training program was more effective in decreasing fat mass, increasing lean mass, and improving strength and overall fitness than just the walking alone. So conclusions that we can draw from this data. First, supervised resistance program with exercise physiology experts really has no additional benefit over an unsupervised walking program in bone mineral density improvement among older men. This was something that I was not expecting to find, but there were no significant differences between the 2 programs in terms of bone mass. Additionally, a resistance program can effectively improve strength, functional fitness, and lean body mass in older men. So that is something that we probably were expecting to find, and that we've seen demonstrated over and over again in the literature and anecdotally. And then finally, the threshold strain magnitude for osteogenesis in men. So that's a mouthful. That basically means the strain magnitude to elicit bone growth or bone mineral density improvement in men just may be higher than that for postmenopausal women. And because this is kind of a new area of study, we're finding that men don't respond in the same way as women do to resistance training in terms of bone changes and bone health. And we can probably attribute that to a higher threshold of strain magnitude. So possible explanations for and the implications of this data. So how can we apply it, and really what does this mean for us as health professionals? Well, one thing that I was thinking about in relation to the results of this study and why things happened like they did. The load to the bone supplied by the resistance exercise might not be greater than that supplied by habitual exercise activities in elderly men. Now, this is going to be situational. That's not going to be a blanket statement that always applies. But one possible explanation for the no significant change or difference between the resistance training program and the walking program was that perhaps the resistance exercise, while they were training to their 8 repetition max, their perception of the intensity may have limited the true load to the bone, if that makes any sense. So in essence, walking would essentially elicit the same thing if the load was the same. It's just kind of a different mode of exercise. Another possible explanation for the no difference is that the type of exercises selected for the study may not have had any additional benefit for bone loading compared to the habitual exercise, i.e. walking. Now, I didn't explain a lot about the type of exercises used in the study, but they were all supported, pin-loaded exercise machines or strength machines. So the seated ones that you see at the gym, that's like pulley leg press and the hip abductor and adductors, those kind of exercises. So they did 3 sets of 8 of seated strength exercises. And maybe those type of exercises didn't give much additional benefit when compared to walking. And in truth, men may just need a different type of exercise. Maybe they need weight-bearing exercise in which they're standing while they're doing strength training. Who knows? And then finally, the article touched briefly on bone loss prediction. As men get to a certain age, just like as women get to a certain age, your bone mineral density is predicted to decrease every year, especially if you're not making a point to resistance train or do weight-bearing exercise and that kind of thing. And it mentioned that according to previous studies, bone loss is predicted to be between 0.2% and 0.8% every year. And interestingly, this study was a year long, and that decrease did not occur in the active control group at any of the sites measured, which kind of goes back to their original research question, which is, what is the minimum level of activity that can maintain bone mass or delay bone loss? And what the study has kind of found is that 3 30-minute walking sessions a week may be the minimum to maintain bone mass as men get older, and that maybe resistance training doesn't have additional benefit in terms of bone health And so really the big takeaway is our statement at the bottom, and that's older men should be encouraged to undertake a resistance intervention for muscle health and muscle improvement, but not necessarily for bone health and the benefits for their bone mineral density. And finally, here is the reference if you're interested in reading the article for yourself. Otherwise, thanks so much for listening and have a great one.